If you notice any of these signs, don't panic, don't Google yourself into depression, just go for testing. Hello guys, welcome to my YouTube channel. My name is Sarah. If you're new here, I do reality content. I film whatever happens in my daily life, and I also talk about important topics in life. And today's topic is a bit more serious, but don't worry, just stay tuned. So we are going to be talking about signs might have an STI. Yeah, so an STI, the full meaning of STI is sexually transmitted infections. Yeah, because some of you are out here saying, I feel fine, but meanwhile your body is sending a lot of notifications to you that you are just ignoring. So, did you know that some STIs have literally no symptoms at all? Yes, zero, nothing, just silence. So, the only way to be sure about it is to go for testing. Yes, don't ignore. So, these are the common signs of STIs. Number one on our list, we have unusual discharge. Yeah, I hope you understand what I mean by discharge. Like the mucus that usually comes from your nose. Now, if you have that kind of discharge down there coming from your private parts, unusual discharge, there is the normal discharge and there is the unusual discharge. You'll just know the difference between the normal and the abnormal, because the abnormal has an unusual smell, obviously a bad smell. It might be more thick than usual, the amount might be more than usual. So you have to know the difference between the normal discharge and the abnormal discharge, and you have to go for testing just to be sure that it's normal discharge and it's not an STI. Then the second one on our list is itching, scratching, irritation. If you find yourself scratching down there, it doesn't mean that you might have an STI, because it might be just something else, but just don't ignore. Yeah, you might never know, So itching is one of the signs of an STI. Then the next one on our list, we have pimples, blisters, or sores. Yeah. I know, like, my face has a lot of pimples, like you can see. Yeah, but these ones should only be on the face. If you have such down there on your private parts, you should be worried. Literally, you should run to the doctor for you to go and get tested. Yeah, because there are many types of pimples. Some pimples might be normal, because after shaving the pubic hair, there is something called folliculitis, infection of the hair follicles. Yeah, so that one is normal. That one is not an STI. So after shaving, maybe some pimples might appear, but those ones are normal. But just on these other regular days, if you notice some pimples, some blisters, some bumps, maybe they are painful, maybe they are not painful. If they are sores, maybe they they have pus in them. Yeah, you should be worried. You should go for testing. Then the other sign is painful urination. Dysuria, we call it dysuria, painful urination. Mostly when you have an STI, when you go to urinate, you're going to feel a burning sensation down there. Yeah, whether you're a girl or a boy, whenever you go to urinate, you feel some burning sensation from your private parts, just know that that might be an STI, and you need to run to the hospital to go and test. Please don't ignore. The other sign of an STI is lower abdominal pains. Mostly for the girls, they might ignore the low abdominal pain, because they might say this is just cramps, this is just like painful periods or what. But you might never know, it might be an STI. So low abdominal pain and back pain, yeah, the signs of an STI. You should go to the hospital and get yourself tested. Then the next sign of an STI The other common sign that you might be having an STI is pain during coitus. Yeah, coitus should be enjoyable, and if you're feeling any pain during something that should be enjoyable, that means that something is wrong with your body and you should go for testing. Yeah, there is a specific STI that has that symptom of pain during coitus, so you should go and get tested. Then the last one and the most scary sign of it all is no symptom at all. Yes, some STIs have no symptoms at all. They have no symptoms at all. You might be feeling fine, you might be feeling okay, but deep down your body is just not okay. So the best thing to do is to go to the hospital for testing. Yes. So, and these are the common mistakes that you usually do. The common mistakes that people usually do, including you. Number one, ignoring the symptoms. You should not ignore the smallest symptoms of it all, because they say prevention is better than cure. You better know that you are sick early enough so that you can go to the hospital and get the treatment and it will be over. Because if you ignore the symptoms and then you wait and then the STI is at its last stages, it's gonna be somehow hard to treat. So the second thing, common mistake, is self-medication. Maybe you feel like you have some discharge, then you run to the chemist, you go and buy some drugs you don't even know the disease you're suffering from. You're just going to prescribe you are just self-prescribing drugs. That's not good. You should go to the hospital, get tested first, and get treated for a specific thing. Because self-medication, like using antibiotics, your body might develop resistance for the drug. So when you need the drug, your body will be like, this drug is, your body will be already familiarized with that drug, and that drug is not going to help you. So, and the third and the last mistake that you usually do is asking your friends instead of asking the doctor. Your friend is not a laboratory. If you feel sick, go to the hospital, get tested. Don't ask your friend. Yeah, unless your friend is a doctor. And doctors are found in the hospitals, not in their houses. Okay? Yeah. So, you should go and get tested from today. If you feel that itching, if you see that discharge, if you feel the lower abdominal pain, if you feel the back pain, if you feel pain during urination, this, and you're watching this video, this is a sign that you should go and test. This is a sign that you should go and test. Yeah. So if you find this video interesting, if you find this video educative, if you love this video, make sure you like, you comment, you subscribe, and you share it to your friends so that this information can be widespread. Let's create awareness to people. This information should be widespread so that people can go and test and treat the STIs early enough before they develop untreatable complications. Yeah, so stay safe, stay informed, and that's all for today's video. Bye.